I'm Adele Cushing. I'm a Senior Digital Education Consultant at Birkbeck, University of London, and I lead the HyFlex operations team.
Hello, my name is Pip Lehen. I'm a Digital Education Consultant at Birkbeck, University of London, and I work on the HyFlex operations team.
Hello, my name is Riccardo Benzo. I am a Digital Education Consultant and an Associate Lecturer at Birkbeck, University of London, and I am part of the HyFlex operations project and team.
Welcome to our presentation today, which is titled From the Beginning, Designing a Staff Development Program, Introducing HyFlex to a UK higher education institution, and follows the journey implementing HyFlex at Birkbeck, University of London. We're going to cover the history and the context of Birkbeck's transition to HyFlex, with an emphasis on the HyFlex development program. Some of the feedback received during the first phase of the project, and what comes next. Birkbeck, University of London has traditionally focused on part-time evening teaching in central London. But as post-pandemic commuter patterns have changed, the current flexible learning model is looking to satisfy new needs. They include the implementation of a blended, flipped learning model utilizing the 6 learning types from L'Oreillard's conversational framework, as well as the Birkbeck baseline Moodle Essential Standards document. The College Vision 2021-2026 is aimed at supporting the institutional needs for Birkbeck's transition into its 3rd century of operations as an inclusive higher education institution. Birkbeck's strategic objective is to roll out as many modules and programs as possible in HyFlex mode by the end of the 2025-26 academic year. The HyFlex project is part of a larger Creative Inclusive Learning project that includes the virtual reality inclusive learning part and has been supported by the UK Office for Students. The HyFlex development program is a key driver in enabling the HyFlex pilot. One of the prerequisites for staff to join in the pilot, amongst others, is to attend this training so they understand how HyFlex works at Birkbeck. In order to frame the project in the context of a British higher education institution, we thought it would be helpful to explain the typical structure of a Birkbeck module and program. Each module lasts between 10 and 12 weeks. Each week contains pre, live, and post-session activities. Moodle, the virtual learning environment, has courses that follow this structure as set out in our baseline standards. The initial focus of the project has been on postgraduate PG modules. We have a flexible teaching model, i.e. a choice of teaching and learning modes. So for example, you could have a student on a program, let's say it's called MSc Digital Education, with 3 modules in a term, but only one for now is offered as HyFlex. The aim is to increase HyFlex teaching and learning for as many postgraduate programs and modules as possible by 2025-26. Our journey began by collaborating with colleagues to define the HyFlex pedagogy for our pilot and overall project based on what had happened previously, while wanting to move beyond live streaming and, as such, increase synchronous learning. The first prototype room was used by the digital education team to test out sound and screens. We had conversations with academics and colleagues in professional services about their concerns and what they might need for effective teaching, i.e. the delivery of HyFlex sessions. We used the Mentimeter presentation to ask questions about the opportunities and the challenges the staff anticipated. We looked at any mitigations which could be applied. Everything we found out fed into our HyFlex development program. The prototype room was not used for HyFlex practice training, as it did not have the finalized set of technology.
This Miro board demonstrates the initial planning of the HyFlex development programme. The HyFlex development programme was designed in collaboration with academics and was directed by their feedback, as well as evaluations from students. So, as staff tried out the pedagogical recommendations and came back to us with feedback, we have been able to update the programme and share those reflections with other colleagues who joined the pilot in later terms. The Miro board was developed with several members of the digital education team to ensure we had not overlooked anything. For example, team members who regularly run classroom tech training were able to provide areas to cover for HyFlex practice. We wanted to run Design and Adapt as 2 sessions, however there were no new HyFlex modules. In addition, the advice was applicable to both scenarios, and so having 2 separate sessions was not required.
The first 2 sessions of the programme were technology agnostic, as we worked towards a HyFlex classroom solution. For the introduction to HyFlex session, we built on BT's 2019 definition of online, on-campus and asynchronous learning. There were different variations of HyFlex happening around Birkbeck, and we wanted to move beyond live streaming. With regards to Design Adapt for HyFlex, we built on our established 3-part active learning model and focused on BT's 4 principles: learner choice, equivalency, reusability and accessibility. We ensured that practical advice on accessibility and equitability was included within each session. Sharing practice with colleagues on the pilot and seeing positive outcomes encouraged other colleagues to engage with the new approach. We advised teaching colleagues that advanced communication and pilot feedback was key. This is in line with research from Datina and colleagues, and right. We received feedback from the Term 1 staff evaluations, which was then integrated into the HyFlex development programme via a key advice summary. The HyFlex practice 3rd session is the practical element of the programme and allows staff to practice a HyFlex activity using specific classroom technology. Introducing pedagogy and key design concepts before using the technology encouraged staff to consider their approach to teaching and student-centred learning. The HyFlex development programme aimed to demonstrate technology, to enact HyFlex rather than control it. During this 3rd session, some staff expressed a desire to be trained only on classroom technology. However, the current classroom design is an interim solution, 1 step in the development process. We wanted to ensure our HyFlex model is pedagogy driven and encourages HyFlex teachers to keep the technology as invisible as possible. We therefore didn't focus solely on classroom technology during the HyFlex practice sessions, but more on the application of what they'd been learning in terms of pedagogy. Some students, when experiencing HyFlex teaching and learning, felt a little disconnected when switching from online to on campus. As part of the development programme, we took the opportunity to emphasise the 2 learning pathways and how core HyFlex technology can bridge that, as well as encouraging overarching communication from the lecturer. As the pilot evolved, colleagues provided feedback via evaluation forms and through informal conversations. We adjusted content within each of the development programme sessions, and towards the end of the pilot we reviewed the content delivery mode for session 1, based on lecturer desire for increased module-specific design and hands-on practical experience prior to teaching. HyFlex pedagogy is the foundation to design planning, and the first session is now delivered by an interactive video. Intro to HyFlex changed from a 60-minute session to a 20-minute video with 10-minute optional activities. We felt this would allow us to introduce the pedagogy, but allow more time for staff to prepare for the Design Adapt session and focus on implementing it into their teaching. The Design and Adapt session was increased from 60 to 90 minutes, which allows more time for individual scenarios and subject-specific questions pertinent to faculties. We will also be providing training via faculty, as the pilot project includes several more modules for the next academic year. HyFlex practice has remained the same, delivered with small numbers to facilitate everyone in setting up and using the classroom technology. As we move into faculty-based training, we will continue to advertise small group sessions, as well as options for those more confident with the technology to practice at their leisure.
This is how the development programme was delivered. We wanted to create an example of a HyFlex module that staff could refer to as a model. It also demonstrates the 3-part teaching model and includes a range of different asynchronous activities. In session 1, we have a Moodle board on HyFlex teaching challenges. This is a pre-sessional task that asks staff to respond to challenges. Not all are relevant to all staff, but these were written in response to conversations and comments from staff who had either done live streaming or in response to current teaching challenges. Having a record on a Moodle board meant it served as an artefact of the course that could be reused, one of BT's principles, for staff joining the pilot and the development programme later on. In session 2, we had technological and pedagogical considerations as a checklist. Prior to the HyFlex practice session, we wanted colleagues to reflect on the pedagogical considerations from the previous session, Design or Adapt to HyFlex, as well as think about accessibility considerations during live teaching. Staff can add their own elements to the checklist, thus personalising the considerations to their teaching. In the final session, we have a post-HyFlex reflections board. This Moodle board, as with teaching challenges, collated staff responses after their HyFlex teaching experience and provided useful feedback both for us in the development programme team and other staff. Future HyFlex teachers can revert to this as a useful guidance of things to be mindful of or tasks that worked well, but also it encourages dialogue between pilot teachers, so hopefully they continue sharing their experiences in the HyFlex community at Birkbeck. Approximately 1/3 of Birkbeck students are neurodivergent, disabled, experience some form of mental health condition, or a combination. They are at risk of disengaging from their studies or withdrawing entirely. The HyFlex Accessibility and Inclusivity subgroup was established to help understand Birkbeck students' learning challenges and develop solutions to overcome them where possible. The findings from the subgroup's work, namely a student and staff consultation in 2023, were integrated into the development programme. In Term 1, 50% of students found the support with accessibility needs to be useful. 46% said the accessibility support was not applicable to them. In Term 2, 58% found the support with accessibility needs to be useful, and 35% said this was not applicable to them. Student feedback from the HyFlex pilot evaluation forms in Terms 1 and 2 indicates that this work and the guidance provided through the development programme was successful. If you would like to know more information on the Accessibility and Inclusivity subgroup, we can share a report with you from the British website Make Things Accessible and a link to a YouTube video on creating an accessible and inclusive environment in HyFlex classrooms, which was based off of the consultation in 2023.
As said in the beginning, we received feedback from colleagues in the pilot about the HyFlex development program. The information shown here focuses on the question, to what extent do you agree with the following? I found this session useful. For Term 1, 58% of the respondents agreed or strongly agreed that introduction to HyFlex was useful. 42% agreed that Adapt design for HyFlex was useful, and 68% agreed or strongly agreed that HyFlex practice was useful. There was a marked improvement for term 2, with all figures going up. 78% of respondents agreed or strongly agreed that introduction to HyFlex was useful. 67% agreed or strongly agreed that adapt design for HyFlex was useful, a massive jump from the term before. And 78% agreed or strongly agreed that HyFlex practice was useful. Indeed, as we fine-tuned the HyFlex development program and worked more closely with colleagues, results improved, and we are still collaborating closely to ensure that we provide what people wanting to use HyFlex are needing.
We received really useful feedback from the students' HyFlex pilot evaluation survey. One student said, "I think my expectations were that this would work a lot worse than in actuality. The teaching staff are responsive and aware of online students, and it is as seamless as current technology, to my knowledge, allows." The points mentioned in this feedback reflect what we discussed with colleagues in the Design Adapt to HyFlex session, namely, treat everyone as if they're in the same room, provide opportunities for respondents to contribute, nominate speakers, and utilise plenaries. Another student stated that this was a very natural process for me, as I frequently have hybrid meetings at work. It works great when people are comfortable doing it, and I commend the lecturer for embracing the technology. This feedback reflects research from Datina and colleagues and Wright that staff willingness to implement, use and practice with new technology was essential for confidence and a smooth HyFlex experience. In Term 1, 45% of students stated they were very satisfied and 42% stated they were somewhat satisfied with their HyFlex learning experience. Less than 1% reported being dissatisfied. There were 55 respondents in total for Term 1. In Term 2, 65% of students stated they were very satisfied and 26% somewhat satisfied, and no one was dissatisfied with their Term 2 HyFlex learning experience, and there were 31 respondents in total for Term 2. We also received really helpful feedback from our HyFlex pilot lecturers, one of whom stated, "I kept asking both groups, in class and online, questions relating to the content and for their opinions. This worked well and meant both groups felt integrated. I split students into groups to discuss the readings and then brought them back together." Another lecturer stated, "My class of 16 MA students worked well together online and in the classroom. The module is highly interactive and it's vital that all students participated. I encouraged them all, except in cases where they were sick, to turn on their cameras. This was vital for student engagement, as a major component of this module is discussion." This really reflects our slogan that was inspired by discussions with Dr. Gina Riley from Cooney University, who we spoke with last year. Our slogan became, "Design for online and teach as if everyone was in the room." As mentioned in the previous slide, some of these points reflect what we discuss in the development programme, namely providing opportunities for respondents to contribute, nominating speakers, and utilising plenaries so students across modality can communicate clearly with each other.
We encourage colleagues to share how their HyFlex teaching was going with others on the pilot and colleagues who were joining the pilot in later terms. Some of the comments on our shared practice Moodle board refer to communication between the online and in-person groups and the different requirements of each. For example, when remote studying, setting up 2 screens, using the chat, and how to participate in the class. All the lessons learned have fed into our planning for next steps to support the decision-making regarding our classroom solution, as well as the continued rollout of the HyFlex development programme for additional HyFlex modules in the next academic year. In this presentation, we have highlighted our journey through an iterative design of the HyFlex development programme, which supports our overall HyFlex project at Birkbeck, University of London. In the next academic year, we look forward to working with an increased number of academic colleagues and modules designed for HyFlex teaching. Thank you for listening.